Oh, hey. Hi there.
Hi, Steve. Tony.
Tony, nice to meet you.
My pleasure.
Come on in.
Okay.
So this is the San Diego Housing Federation. We're a small nonprofit, and we advocate for the increased supply of affordable housing for those most in need.
I know homeless people need more housing. How do we get housing? How does that process start?
Well, the market doesn't provide housing for homeless people or the very poor at all. I mean, it just doesn't produce new housing on its own. And so we have a system. Most of the affordable housing that's produced in the United States is created with a kind of financing we call tax credit financing, where we ask private entities to put money aside in exchange for tax benefits. And then a lot of nonprofit and some for-profit housing developers use that with other grant sources and special loans to build new housing that is in effect subsidized to maintain very low rents. So it's a very complex field, and as a result, most people who build market rate housing, the stuff that's just going right on the market, don't build the affordable housing. And the reverse is true, that people who build affordable housing typically don't build the market rate. The way we get affordable housing otherwise is housing that has been built typically after 20 or 30 years after it's originally built, if it's in an undesirable neighborhood, if maintenance has been deferred, then typically that's where we get a lot of the truly affordable housing. So like the SROs that are downtown, the ones that are still really cheap, it's because they paid them off. They paid off that loan, decades ago. All they're paying is property taxes, and they don't put money into maintenance. And they couldn't rent them for any more than they do.
Yeah.
So the difference between those two underscores the difference between what we call affordable, naturally affordable housing, which is housing just happened to be inexpensive because for all the undesirable reasons, they can't sell it on the market for much, versus what we call capital A affordable or subsidized housing, where it's high quality, it's well managed, it has services embedded in it, and it's brand new, and is maintained in a way that it will be of top quality for 15 to 55 years, depending on the requirements. So yeah, it's an important distinction. People are often very much opposed to having affordable housing in their neighborhoods. You'll hear people talk about that. And mostly that comes from the fact that they don't want badly run down, crowded apartments in their neighborhood, which is naturally affordable. They don't realize the distinction between that and what we call subsidized affordable housing, which is professionally managed, inspected regularly, has to maintain certain standards. And actually, when you get that kind of housing put into a neighborhood, it brings up the surrounding quality of life. It doesn't bring it down. The other kind of housing, where you have absentee landlords who are just there to rake the rents in, that's where you get negative impacts on the community, where the landlords don't care, they don't reinvest, and they don't really work with their tenants to maintain the property as well. So it's a stigma that we fight against, because people do resist building affordable housing. Now, there's also resistance just to building housing at all. People like to think that the community character is something that they were guaranteed when they bought their house, that they bought the entire package, the entire community. And so there can be resistance sometimes to building any new housing. And when that happens, that means there's less affordable housing coming out of the market, because there's a shortage of supply, and so everything gets bid up to the highest price. And that's like 3 answers to one question, I think.
I hear there's a new housing development that you had something to do with in Talmadge. Can you tell me about that?
Sure. That's a project that the City Heights Community Development Corporation is doing with Wakeland Housing. And it's a site just on the edge of Talmadge, which is a very upscale community. You know Talmadge by...
Kensington, isn't it?
Kensington and Talmadge are continuous there. It's on the two sides of Fairmont, really. On one side is Kensington, on this side is Talmadge. And that's an important distinction, because Kensington has this nice Adams Avenue commercial district, and Talmadge doesn't have a commercial district. They really have El Cajon Boulevard, which they don't see as a place they want to go to. But there's a site there on Euclid, between Euclid and 47th, that was an old car yard. It looks sort of like a wrecking yard, but I'm not sure what business was really going on there. And the CDC wanted to develop it for affordable housing. And what worked in this case, because all the things I've talked about before, where people are resistant to affordable housing because they don't like what it does to their neighborhood, here was a case where we could take one of the worst sites in a neighborhood, I mean a visual eyesore of these cars, and turn it into new quality development. And so part of my job working with the CDC at the time was to go to the community and ask them to support this project. It worked because, one, I have a lot of credibility and relationships there, so when I say something, I actually am standing behind what I'm saying. They know I'm being honest. It doesn't mean that I can say anything at all and they would buy it. It just means that I have a track record there. So it's important that you have trust. We had worked with that community prior to the project to see what we could do with that stretch of Euclid, because Euclid sits there, it's their only commercial space that really goes into Talmadge. And so they wanted destinations when they walk their dogs and things like that. They'd like a destination for a beer or a cup of coffee. And we understood what they wanted on Euclid was to improve the streetscape, do some traffic calming, and create some commercial destinations. And so we knew that going into the room. And so part of our advocacy for this project was to guarantee that some small portion of the project would have commercial that we could purpose for the neighborhood. So rather than serving the tenants of the housing, it was intended to be an attraction for the residents of Talmadge. They'd have somewhere to go get a cup of Starbucks. And it was interesting because when we started the discussion, we were going to try to build family housing there. And when you build affordable housing, because these financing structures are very specific to the population you're serving, you have to go in with a particular focus for certain kinds of funding to apply. We started with families, reading what the regulations and availability were, and we went more towards a mix of family and seniors. And then really in response to the renewed focus by the San Diego Housing Commission on reducing homelessness, we ended up with a project that was 60 units of permanent supportive housing for recently homeless seniors who were medically at risk. So a very defined population. And the reason you define those populations, of course, is because if you're going to do permanent supportive housing, you have to support it with the services. The services have to be matched to the population that you have there. And so you can only get certain kinds of money for certain kinds of activities. And so an affordable housing project is very complex because not only is the basic financing very defined, but so are the services and requirements then, and the building itself has to match the purpose.
Boy, a lot of things have to come into flux there.
Yeah. No, it isn't just building an apartment building and saying we're going to keep the rents down. For instance, if you're required to do a certain amount of medical screening, these were medically at-risk seniors, and so they need to have certain basic on-site clinical support. When you build permanently supportive housing, you are entering into a contract to provide that housing for a time frame based on the financing, which can be 15 or 30 or 55 years. Part of that agreement says you will provide the services for that term. So whereas you will not likely get a commitment from, say, the county for 55 years, I wouldn't expect, you are required for the time that you operate this and enjoy the financial benefits of operating it, you have to provide those services for that term. So it's defined in the loan and operating agreements, not in the sources. And then it's your responsibility to go out and find those, as the developer, to go out and find the sources to fulfill the obligation that you've agreed to.
It does sound complex. It doesn't seem like it's going to work. How can you actually make progress on it? And would it be cheaper to just renovate these old SROs?
Because most of the ones that still exist are in such an advanced state of decay, or they were originally built badly and they have health and safety issues, or the plumbing systems, all the things that make a place habitable and able to support a lot of people. These are very expensive systems, and so the actual cost of renovating one of these buildings exceeds the cost of building a new one in most cases. And the question is, what do you do with these, what we would consider substandard places now? Do we continue because it's the choice of that or the streets? Do we continue to support people living there, or do we say this is undignified, we need to replace them? I would argue that it's irresponsible to take things out of service, to remove housing in a time when we have such a crisis, even if we are adding some. So we should be protecting that which exists until we can build more. To build more, we're going to require a lot more money, and it's uncertain right now what will happen at the federal level. But at the state level, there's a lot of support to continue to put money toward this. Other things we can do is we can make it easier to build housing in general, because the constrained supply, when we talk about what becomes naturally affordable housing, the constrained supply means that there's less housing that is filtering down to the more affordable. I mean, so if you look at housing that's 20 or 25 years old now, it's not aged into obsolescence yet. When I moved into this neighborhood in 1980-something, Most of the housing here was 50 years old. If it was the single-family homes, the apartments were typically maybe 20 years old,
Yeah.
and they were undesirable. Okay, now those same apartments have been upgraded, and they're not affordable anymore.
Yeah, that's true.
And so you have a lot of people competing for small number of housing units. So, I think the answer is we got to build new, and we've got to prevent the loss of naturally affordable housing while we're doing that.
There's a place on 16th Street that it's an art museum, art gallery, whatever, but they have this project where they're building affordable small houses for the homeless.
Can we not just build a lot of these tiny houses and house people? If you look at the scale that we would need 8,000 of them if we want to house everyone who's sleeping on the streets right now, that still requires land.
Yeah.
And is every one of those 8,000 really suited to live in a tiny house? If there's families, if you have medical needs, it is a very low density type of housing, and with land in such short supply here, we really do need things that are more high density.
Yeah.
And then, and I will argue at the same time that if those 8,000 were homeless because of an earthquake or a tsunami or a wildfire, I would believe that we would have all 8,000 of them in Red Cross tents tomorrow.
Yeah.
But because the people sleeping out there are there because of a slow-moving economic calamity that's taken years, we sort of don't feel a compelling need to solve that.
Yeah, you mentioned we need more resources to build more houses. What exactly do you need?
We need more money to buy land, to build buildings.
Yeah.
The ways we could get that, I think we could, regionally we need to pass some kind of a revenue measure. We in the region apparently were prepared to spend 2 pennies of a TOT, the hotel tax, just to build a single stadium for a billionaire. Why we can't take that same $1 billion and apply it to solving a piece of the housing crisis, I don't know. I think we should be looking at that. We should be looking at maybe a local sales tax or local property tax. So I do believe up and down the state there have been 4 very successful measures just in the last election. We need to look locally at what we can do to raise more money through one of those sources and put it toward homelessness and low-income housing. So one of the advantages of getting this kind of money is that we tend to leverage local resources like that, sometimes as much as 5 to 1. So if we could raise $500 million, that could be $2.5 billion that we could be spending on housing more people. And because sometimes you have as many as 4 or 5 different funding streams on a single project, if you can get the one, it is often the peg that you can hang all the others on. It's the match money. And so it could be the tax credit financing. It could be a special grant for like cap and trade dollars. It could be, there's a number of different sources that you can get. Home funds or CDBG from the Housing Commission. There's any one of these things, and if you can match them, obviously if you're looking to cobble together enough money, the more sources the better. But also when you have local funding, it makes you very competitive when you compete at the state level for the competitive funds. One of the things they look at is what level of funding do you have locally to match it, and if you score high in that, you much improve your chances of a successful application. And so it's going to be important for us to find local revenues so that anything that happens either nationally or statewide has a match. And again, I liken it to the peg on the wall. Once you have that peg, you can start hanging other things on it. Without the peg, nothing sticks. There's 120 units in this building. They had 1,500 qualified applicants before they even opened.
That didn't surprise me.
No.
You're saying we need more low-income housing. How can the general public support that?
That's an important question. And I think for the average citizen, the best thing you can do is to be well-informed. So study the issue a bit, because there's a lot of misinformation that goes out there, and that results in people resisting, actively opposing the production of new housing and new affordable housing. People believe that that affordable housing brings crime, and we have statistics that show the reverse. They believe it brings down property values, and I can show you studies that show that either has net zero impact or some improvement if it's especially in a poorer community. We need to overcome the stigma of who is qualified, because frankly, the people who qualify for low-income housing are people who work in the stores where you shop, who serve in the restaurants where we eat, who are the nurses and teachers, and the population that is eligible for low-income housing is us.
Yeah.
Okay, and so people just have to understand that it is not a crime to have a low-wage job, and we shouldn't criminalize that. And also, our communities need a balance of people, because we can't all be scientists and biotech engineers and coders and programmers. Those people need people to support them. One of the most important things I think that we can do is to get to know the people that we deal with on a daily basis. Don't treat people as others just because they're bringing us a cup of coffee. Recognize that they have reasonable expectation to live in the community where they work, and that it is to the benefit of us all if we are all a part of this larger community. Take the time to actually engage in a discussion. If we disagree with somebody, try to understand what they mean by the words they're using, especially in a time like this where there is so much false news out there. There is so much static that is produced that we need to be better about identifying what is true and what is not, and to have these conversations with people so that we test our own notion. Don't assert our own notion of the world, test it a little bit.
Yeah, that's true. That's true. That is a problem, misinformation.
Yeah, and so I think when we talk about what we can do, support the good things that we see happening. So in Talmadge, because we spent time with that community, people were aware of what the project was.
Yeah.
And so when other people started to spread false information about it, they were able to call them on it, either directly or let us know so that we could communicate out the correct information. So the extent that each of us is responsible for what we see and hear and come to understand, that is the point where we have the most ability to control things. The extent that we're willing to stand up as individuals when it comes time at a public meeting to say, no, I actually believe in this, I support this. One of the things that made a big difference in Talmadge was a young couple, but they said, we would welcome that kind of well-managed, professionally supported housing in this community. It would be better for all of us if there was more of it. Those voices made a big difference. It was important to have advocates who lived in the community who said, yes, we do want this here. Affordable housing doesn't create crime and bad social conditions. The concentration of poverty does that. Because that is shown. It's like if you put all the poor people in a city in one neighborhood, guess what? You get an impoverished neighborhood. If you take those same people and they live in different parts of the community, they actually have better access to opportunity. And so you don't have an impoverished community. You have communities where some poor people do live. Even something as really powerful as this No Place Like Home, where they'd be repurposing the mental health money to build permanent supportive housing, it will require the locals to actually match with service money to make sure that the services are provided. That was passed last summer. The money is theoretically available now, but because it has to go through a process of court validation, program design, RFPs and announcements and distribution, I would guess it's going to be 3 more years before a single door opens. And that's just a very good example of what happens with these kinds of programs. And people can say, well, that's waste, fraud, and abuse. It's like, no, that's due process. There are things we could do maybe to simplify that, and if the local processes weren't so difficult. So people need to be more thoughtful about why do things take a long time, because it's not a simple matter of here's the money, go build it. How do we as the public know that we got what we said we were supposed to get out of this? And so programmatic definitions are part of the social contract. Yeah. If we're going to give money to somebody to do something, how do you define whether or not they performed in their public duty?